The NCID confirmed that the Jubilee Hospital in the heart of Hammanskraal has recorded some of the typhoid cases. The majority of the cases were that presented in children.
And we are currently investigating a surge of cases in typhoid fever, specifically in Gauteng in the city of Tshwane. The two areas that we are investigating are Bronkhorspruit and Hammanskraal. The Bronkhorspruit cluster consists of 14 cases, all identified, 13 identified from Bronkhorspruit Hospital and 1 from Netcare Bronkhorspruit. In this area, we are seeing an average of 1 case per week, and this strongly suggests that there may be a persistent or intermittent source of infection. In the Hammanskraal area, the cluster consists of cases mostly reported from Jubilee Hospital. There was a sudden increase in cases seen in the last week, and that strongly indicates that there may be a common point source. In the last week, the majority of cases were children under the age of 15, with the youngest being 8 months of age. To the best of our knowledge, there have been no fatalities. However, this still needs to be confirmed by our investigating teams.
The health department says there's no need to panic, as typhoid fever is endemic in South Africa and isolated cases can occur throughout the year.
Typhoid is one of those waterborne diseases, just like a cholera, caused by a contaminated water. Obviously, this is linked to the issue of sanitation and the lack of hygiene. So hence we want to say to South Africans, to the SABC viewers, look, the situation is under control. The NCID surveillance team is on the ground in order to identify where could be the source of this typhoid, so that they're able to assist us to educate the public accordingly. But the most important part is that the situation is under control.
The department has reminded those who present with the following symptoms to seek professional medical help immediately.
Anyone who experiences any of these symptoms, vomiting, diarrhea, body pains, stomach cramps, they must not try to self-treat or diagnose. They need to go to the nearest healthcare facility.
The transmission of Salmonella typhi is through the consumption of contaminated water. This is a concern for the country because nationally we have already surpassed the cases that we have seen in 2024. In 2024, we saw a total of 139 laboratory confirmed cases, but to date, in October 2025, we have seen 145 cases. To control typhoid fever, it involves a multifaceted approach, which includes frequent hand washing, drinking safe water, eating properly cooked food, and antibiotic treatment.
The NCID also expressed concern that typhoid fever remains a serious concern, especially in areas with clean water challenges. Meanwhile, several people died in 2023 after a cholera outbreak in the country, with Hammanskraal in Pretoria confirmed as the epicenter at the time. In a bid to prevent another deadly outbreak, the health department has appealed for everyone's cooperation. Patricia Fasagi, SABC News, in Pretoria.